More than 400,000 Connecticut residents have filed for unemployment. That's 20% of the population, and a rate Governor Lamont says the state hasn't seen since the Great Depression. But officials say the key to getting residents back to work safely is contact tracing.
This is a tried and true method of limiting an infectious spread, and it goes back 100 years.
In partnership with Microsoft, the Department of Public Health is working on a program called Contact to perform widespread COVID-19 contact tracing. The goal is to contact every single confirmed case of COVID-19 to find out who they were in contact with before they got sick and during. They will then reach out to those individuals and advise them if they should get tested and self-quarantine.
And this is something that we routinely use for other infectious diseases, including including measles. We're looking to adapt the strategy for COVID in order to help stop the spread of infection in our communities and prevent small clusters or individual cases from turning into larger community outbreaks.
How we're working with our local departments of public health. We've got 15 of them lined up right now, and we've got volunteers. We hope to get, I think, hundreds of volunteers are already doing this. Get another 500 volunteers in the near future.
The Department of Public Health says individuals who are asymptomatic are especially important to trace because they could unknowingly spread the virus to close contacts.
We will be integrating this data with our contact tracing system in order to rapidly interview people who test positive for COVID.
The department plans to launch the program mid-May. Governor Lamont also discussing how the day-to-day decline in hospitalizations means the state is moving in the right direction. But we spoke to UConn Health epidemiologist Dr. David Bannock to find out what the data means.
That graph shows that when you're below zero, that means that you have fewer hospitalizations. So essentially, more people being discharged than being admitted, and that's an optimistic thing. We use a 3-day average because we know there's going to be day-to-day fluctuations. And I think the fact that we're seeing signs of plateauing and decreasing hospitalizations is a reason for some optimism. But certainly, this isn't going to be a situation where things are going to all of a sudden go to zero. I think we're going to continue to see hospitalizations. This will take time, but again, as long as we're seeing things in the right direction, I think that's a positive thing.
Dr. Bannock also says when looking at the number of people dying from COVID-19, it's important to understand it from different perspectives.
When we look at that number, we just have to bear in mind that we're seeing high rates among really very specific populations. So we're very focused on older patients living in congregate type facilities like nursing homes. That's really been a big focus at this point.
He adds medical officials are already beginning to look at how COVID-19 could affect Connecticut come fall.
As we start to head into the summer, we're certainly approaching the fall and particularly the winter with a lot of caution, recognizing that traditionally these viruses tend to circulate more in those seasons, and we would be potentially concerned about a resurgence in the future months. People ask, what are we going to do? What can I do to help prepare for the fall and this whole issue with the flu and COVID-19? So I think encouraging people to get vaccinated is, a really important public health message at this phase.
Zania Maldonado, Fox 61 News.